how does this sort of play out in a surgical patient? Again, this, to Professor Chenea's question, this gentleman actually presented with an unknown primary tumor. This is his initial endoscopy. This is a 50-year-old gentleman with this sort of very subtle lesion here, and essentially one 4 by 3 centimeter lymph node. And he's 50, so we're hoping for frontline surgery to minimize the late side effects of radiation therapy. And even though there was this very subtle asymmetry that you see here, I was able to identify the tumor. But what was interesting about him, he has this one node, and it's very typical, and it's hard for us to predict the number of nodes that are involved, and in fact, it's hard for us to really measure the extent of disease. But in this patient, he did not just have this single node here, but there were 5 out of the 34 nodes that I removed. And after a resection, given the 5 nodes without the extranodal extension, he went on to have a postoperative concurrent chemoradiation. And just to contrast how we're going to see this used for chemo-RT cases, in this gentleman, he went from a measured level of 194 to immediately post-RT, and unfortunately I did not get an immediate post-op level. He went all the way down to 0. Now, he's only about 6 months out, so we're going to repeat that. No, he's 6 months from treatment, but we're going to repeat that with the planned follow-up that we have moving forward. But it's interesting to me how this assay does correlate with the extent of disease, whether that's the neck or the primary, independent of my physical exam.